Thank you for the opportunity to give a speech here. My name is Jiayi Feng. I'm from Chinese Academic of Medical Science and Peking Union Medical College of Plastic Surgery Hospital in China. Today, my topic is the treatment of exogenous hyperpigmentary disorders following silver ion-related chemical exposure with 1064 nanometer Q-switch laser, a 10-year follow-up. Here's my self-introduction. So, the tattoo is a common cause of exogenous pigmentation. Like the picture on the left, it's very artistic, right? But another kind of exogenous pigmentation is trauma. As a result of trauma, exogenous substance enter the dermis, and when the macrophages cannot clear them by themselves, the pigment of the substance will be exposed to the outside of the skin. And today we're going to report a case of pigmentation caused by silver ion-related chemical exposure and successfully treated with 1064 nanometer Q-switch laser with 10 years follow-up. So, she's an Asian female. When she was 29 years old, she was caught in an explosion during a chemical experiment. The chemical reagent contained silver ions. Her face and neck were burned, scaled by first-degree burn at that time. No scar or pigment was left after the recovery of redness and swelling. And 1 year later, as the picture shown, irregular pigmented patches gradually appear on her face and neck and get darkening. The area where the pigmented patches appear was exactly the reagent splash area. And the whole procedure utilized the 1064 nanometer Q-switch anti-YAG laser. On August 2011, the treatment of tech spot on the chin was performed. And at 3-month interval, no deepening or expansion were seen on the lesions, so the facial pigmentation was continued to be treated. The setting were 4.2 to 4.5 joule per square centimeter, and with 4 millimeter spot size and 10 Hz. Immediate intensive intradermal hemorrhage was regarded as the endpoint. And in the 10-year treatment, digital pictures were taken before every section. The total number of treatments was 10 in 10 years. In 2021, the original facial hyperpigmentation was completely recovered, with no evidence of recurrence, compared with which we can see the untreated lesion on the neck have darkened significantly, like this. So, it demonstrated that our treatment strategy is successful. In this case, the hyperpigmentation occurred 1 year after the chemical explosion injury. It was considered that the silver ion particle fell into the dermis through the damage of the skin during the explosion, and the particles gradually darkened under the later oxidation, so the color spots appear. As we can see from the picture, the facial pigment gradually disappears after treatment, while the untreated pigment on the neck become increasingly darker with time. So when silver ion-related hyperpigmentation occurs, it should be treated as soon as possible to avoid the aggregation. And most of the pigment particles after laser can be physically broken without chemical changes. But for some pigment, for example, The red tattoo can contain iron, and the white can contain titanium. They may deepen significantly after laser treatment, which is caused by the reaction of iron trioxide or titanium dioxide. And it was also reported that after Q-switch laser treatment of traumatic tattoo contains flammable substance, such as the gunpowder or fireworks fragments. The pigment density is larger, and the distribution is more diffuse, and even a trophic scar appears in a later stage. It is suggested that the mechanism of the adverse event involves the induction of microexplosion in the tissue. So, in conclusion, the Q-switch laser is effective and with safety profile in the treatment of exogenous pigmentation associated with civil ions. And the experimental treatment should be performed before laser radiation. For traumatic pigmentation caused by different causes. And that brings me to the end to my presentation. Thank you for your